Hello, and welcome to this webinar about the COVID-19 study titled A Cohort Study of Men Infected with COVID-19 for Presence of SARS-CoV-2 virus in their semen that Cryos carried out in 2020. My name is Lasse Rasmussen, and I am the PR and Communications Specialist at Cryos. Joining us today from the Cryos scientific team are Anne-Bine Skytte, Scientific Director, Medical Doctor and Specialist in Clinical Genetics, Saghar Kasiri, Director of European Operations and Clinical Embryologist, and Burke, Clinical Embryologist and Tissue Bank Director of the Cryos US Sperm and Egg Bank. So, Saghar, will you introduce us to the COVID-19 study by telling us what prompted you and the rest of the Cryos scientific team to carry out this study so early on in the pandemic?
Hi to everyone, and thank you very much for the invitation to discuss our studies at Cryos International, the largest sperm and egg bank in the world. Of course, being an international bank, it was of great interest to us to be able to find out whether there is an impact of COVID-19 on the sperm. And not only for us as a bank, that was hugely important, but also for many in the field of reproductive medicine. And therefore, during the time when we decided to do this study, it was right at the beginning of the pandemic. There were information and studies coming out that were contradictory to each other. And because the health and safety of our donors and health and of course, the quality of the sperm Cryos produces, it was hugely important that we also do our own investigation and find out about the actual impact and whether we can see any COVID-19 virus in the semen or not. We knew that there was some discussions and studies on the impact of the virus on different organs in the body. And in particular, some recent studies that have come down that indicated that there could be some impact on the ACE2 receptors, which are also found in testicular tissue. They could play a part in the pathogenesis of the SARS-CoV-2 virus. For this reason, it was quite important to see if we can see the virus in the semen. And there were other studies, and also in March 2020, when the pandemic became a huge open discussion and problem across the world, it was necessary to see whether all treatments should be stopped, whether all productions of semen and egg, especially with the donors, should be stopped or not, and it did temporarily stop. And therefore, it gave us a chance at Cryos to be able to proceed with this study a bit further to help. I mean, we had recommendations from ESHRE and ASRM, and we tried to follow all the guidelines that we did to do with the health and safety during this study. But the previous studies that we had seen that came out within those initial few months of the pandemic showed that some of them actually showed that they had seen the virus in the semen. Some had shown that there was no evidence at all. For example, the Holtman study showed 18 patients who had been recovering from SARS-CoV-2 infection, but no evidence of the RNA in their semen. On the other hand, we had other studies that actually showed that they had seen some virus in the semen, and I think there was another study by Tan, which examined the semen from 34 men who had recovered from SARS-CoV-2, and they also demonstrated no viral RNA in the semen. So some previous studies also examined the semen recovery from the recovering men who had COVID-19, but during the acute phase of the disease, and which is something that we were very interested to do, that we test men who are positive for COVID-19 during actually the period that they have the disease, not afterwards, because The initial problems of some of these studies were that at that time, the tests were not coming back until sometimes up to 2 weeks. So by the time the men were tested and we received the results, it could have been quite late or later on from when they actually contracted the virus, and therefore would not give us a clear picture. So many infected individuals, men who actually did the research and came through our research as well, they were during the period that we were looking at their semen and they had the COVID-19. Our pilot studies therefore tried to diagnose men that had COVID-19 with a PCR test, which my colleagues will explain later. And then we looked and see if we could determine whether we could find the COVID-19 virus in their semen or not, and whether it can be transmitted through sexual transmission or not.
Thank you, Saghar, for the introduction to the study. Moving on, Corey, could you describe to us how the study was conducted in terms of methodology and materials?
Well, the work was conducted in the laboratory of Cryos International in Orlando, Florida, between March 10th and October 29th, 2020, during the height of the onset of the pandemic. Eligibility and criteria included men between the ages of 18 and 60 with an intact reproductive tract who had tested positive for SARS-CoV-2 by nasopharyngeal swab. Exclusion criteria included men who had a vasectomy, had a urologic condition that inhibits ejaculation, men taking testosterone or hormonal treatments, and men undergoing chemotherapy, immunosuppressant medications, or had a concurrent acute infection or chronic infection during this time. Participants were asked to provide a specimen free of contaminants by washing their hands and the tip of their penis, and not to use saliva in the collection method. Specimens were, once they were received in the laboratory, specimens were aliquoted into cryovials and frozen and stored at minus 180 degrees until transferred to the testing laboratory. They were transferred to the testing laboratory using a dry shipper, so the temperature was maintained for the whole period of time. At the testing laboratory, they were maintained at minus 80 degrees until they had the RNA extraction done. All the specimens were extracted and then compared using SARS-CoV-2 primers to see if we could find any viral particles in these specimens.
Thank you, Corey. And moving on to the results, Anne-Bine, could you tell us what did the results of the study actually show?
Yes, thank you. We ended up including 18 men between the ages of 24 and 57 with a median age of 32 years. The time from virus detection to semen collection ranged from 1 to 28 days with a median of 6 days. 11 of the men who were included were symptomatic for COVID-19 at the time of semen collection. One of the men remained asymptomatic and tested positive both 6 days prior to and 5 days after collection. 2 of the participants were symptomatic. Of the men who were symptomatic tested positive at 14 and 16 days prior to providing a semen sample, but were not retested. And then finally, 3 men were diagnosed 21 to 28 days prior to semen collection when they were recovered from symptoms. 1 of the study participants remained symptomatic. The severity of the disease was ranked by the study participants themselves on a scale from from asymptomatic, mild, moderate to severe, with severe designated the requirement of hospitalization. 1 man was classified as asymptomatic, 2 were mild, 15 were moderate, and 0 was severe. And regarding the symptoms, fever was the most common symptoms, with almost 90% having a fever. The distribution of the rest of the symptoms are as you know them, body aches, loss of smell, headache, fatigue, loss of taste, and respiratory issues, and the flu-like symptoms. Irrespective of symptoms, at the time of semen collection, no semen samples tested positive for SARS-CoV-2. And results from the PCR assays for all samples were negative. Using serial dilutions of the positive control, they stayed negative. Results from spiking positive controls assays from extracted samples showed no substantial inhibition. So all the results were negative.
So, Corey, how much do we know about SARS-CoV-2 and what research has been conducted so far?
Well, SARS-CoV-2 was diagnosed the first time in December of 2019 in Wuhan, China. Since then, there's been a lot of research that's gone on. It's been questionable, some of the research. We've had various results. But I think our study has been the first to look at people who are currently infected with COVID and not recovering from COVID. Our pilot study examined semen for the COVID virus, and we did look at people who were actively infected with it. And I think it is a good study to show that it is not in people who are actively infected with the virus.
What did other research on COVID-19 studies on sperm report? It seems that one particular research by Lee et al. Reported results opposite of the Cryos study.
Yes, that's an interesting research. They examined 23 patients, and out of those 23, 6 had SARS-CoV-2 RNA in their semen. It seems that those six patients, actually 4 of them were acute and 2 were recovering from the virus. The finding was very well covered in the media, and of course it projected that there was proof that we had the virus in the semen. However, even though they carried on further PCR testing, but the methodology of the study that was published was not very clear, and therefore there was a speculation about both the specimens and the collection and whether there was any biases and so on. For example, there could have been a possibility of contamination with the semen samples, maybe from saliva, or maybe even perhaps from respiratory secretion that might have resulted in the positive result. But I just want to mention also that there was a similar study to ours, which was by Kasiri et al. And they found no evidence of the viral RNA in the patients that they studied for SARS-CoV-2 infection. And I think they had 16 patients. And then there was also Song et al. Who also found the same result in 12-month study, and that was very similar to our result. So out of all the research that's out there, there seems to just been 1 or 2 that have been showing there may be the virus in the semen. The rest seem to be quite similar to the study that we have done.
So, Anne-Bine, could you tell us what is the clinical relevance of the results of this study?
Yes, I'll try. The presence of SARS-CoV-2 in semen has been difficult to study, particularly in patients with severe infections due to the severity of the illness, because most patients with severe infections are not healthy enough to provide a semen specimen and are not typically seen in assisted reproduction clinics. And hence, they are not the focus of our study. But and on the other hand, it's a weakness of our study that it has not included any severely infected men. Therefore, we cannot exclude the potential that semen from these patients could harbor the virus. But based on the data from our study and others, we believe it is highly unlikely that SARS-CoV-2 exists in semen from infected men that have not been hospitalized, or in those who have recovered, irrespective of symptom severity in these populations.
Does this mean that SARS-CoV-2 cannot be sexually transmitted?
That's a great question. We refrain from making these determinations on the ability of SARS-CoV-2 to be sexually transmitted. That's a really big question. We know that it's not in the semen, but sexually transmitted can mean a whole lot of things. So we can't say that it's not sexually transmitted. I mean, when you're talking about sex, you're talking about many things other than just semen. So we can't rule out that it can be sexually transmitted, but from our study, we don't feel that it can be sexually transmitted through semen.
So that concludes our webinar on the Cryos COVID-19 study carried out in 2020. Thank you for watching this webinar with us and joining us today. If you want more information on the study or about Cryos in general, please go to cryosinternational.com and find more information there.